A small part of Americans are experiencing breakthrough infections of coronavirus, which is when a fully vaccinated person tests positive for COVID-19.
Compared to unvaccinated individuals, fully vaccinated individuals have a 95% less chance of becoming infected. And that's terrific. So these vaccines work very, very well. But breakthrough infections happen.
This is Dr. Lisa Maragakis. She leads research in infection prevention at Johns Hopkins University School of Medicine. She says these breakout infections are happening for a number of reasons.
First, I would point to waning immunity. So many people were vaccinated now, maybe 9 months ago in some cases, and immunity does wane over time. So it's certainly possible that people are becoming a little bit more susceptible as time goes on. The second factor that's happening is that we have new variants circulating. And so the Delta variant is one of these that has rapidly taken over in many parts of the world, and certainly here in the United States as well. More transmissible, causes, in some cases, more severe disease, and seems to also be associated with more breakthrough infections. And then the third thing I would point to is public health policy. So we stopped masking when the CDC changed guidance on May 13th. And that was quite early when many people were not even eligible to be vaccinated, and many had chosen not to yet be vaccinated. Then we're starting to see some effects.
A renewed push for social distancing and mask wearing is already happening in some cities, and returning to these measures could help reduce breakout infections for vaccinated people.
An analogy might be sunscreen. It protects you from the rays of the sun, but it's not 100%. And over time, and with increased exposure, you can still get burned and have skin damage. So we need to think of it as an important step that protects you, but then layer on other safety precautions, common sense ways to interrupt transmission to other people, like wearing masks and washing our hands, physical distancing, and really staying home when you're symptomatic.
As for whether these breakout infections can spread between people, much is still unknown, but current research indicates that these rare cases may be transmissible.
And from a medical and physiological standpoint, it makes sense that if you have a breakthrough infection, you do have virus that is in your upper airways. That's why we can detect it when we do the test and you test positive. So it stands to reason that these individuals, especially if they're in close contact with others without a mask, could pass the virus on to other people.
None of this should make you doubt the effectiveness of vaccines. Breakthrough infections come with mild symptoms and often no symptoms at all. The most immediate danger remains for those who are unvaccinated. Almost all U.S. patients who have died in summer 2021 from COVID-19 were not immunized.
We're very, very fortunate here in the United States to be to have access to ubiquitous vaccine, and that is not true around the world. And that really threatens the whole worldwide community, because as long as there are unvaccinated people out there and the virus is still being transmitted, we are at risk for new variants emerging and spreading around the world.